In room 2, and then I'll head over. Okay. Perfect. Of course. Thank you so much. Yep. Bye. Hi there. It's nice to meet you. Of course, I will be taking care of you. My name is Kate. I am one of our registered nurses here. So what I'm gonna do is take all of your key vital information, and when the doctor is ready, they will come in after me, okay? Of course. So you already checked in and filled out the form at the front desk? Perfect. Okay. I'm just gonna confirm a little bit of additional information, alright? Can you confirm your first and last name for me, please? And your date of birth. Thank you. Perfect. And then can you confirm your phone number too? Amazing. And then you are here just for like an annual checkup, correct? No major concerns. Okay. And a couple other questions that we did not ask you at check-in. We do not ask them in a more public setting is, are you a smoker? No. Lovely. And do you use any nicotine products? No. Okay. Vapes? No. Okay. Perfect. And do you wear glasses? Okay. What about contacts? Okay. Have you ever been prescribed either of those? No. Okay. Okay. And then is anyone in your immediate family, so that would be siblings, parents, grandparents, do they have any major health concerns or issues, any major diagnoses that we should know of? High blood pressure. Okay. And which side? Paternal or maternal? Okay. Perfect. Appreciate that. And to confirm, you have never been to our office, is that correct? Perfect. Well, welcome. We are very happy to have you here. We hope that this appointment is very peaceful and relaxing for you, and hopefully it encourages you to come back on a future visit here. Absolutely. Perfect. All right, and all right, so just gonna leave that there so I can take notes throughout your appointment. So what I'm going to start off with is just a light visual inspection of some of the features of your face, and then I'll probably just do again some basic vitals. If there's any questions you have, please let me know and I'm happy to answer them. I can slow down for you, whatever would work best for you. Okay, so first I'm just going to do a quick, again, just visual check. If you can just stay still for me. Perfect. I'm just gonna do a quick. Alright, everything looks pretty usual there. And I don't see anything super concerning. Okay, perfect. Alright. So good. So far, so good. Yes. So how is your day going so far today? That's very good to hear. I love that. Alright, so first I'm just going to do some hand sanitizer before I grab my gloves. Alright. it's a pretty efficient hand sanitizer for sure. Okay. Alrighty. Next, I'm just gonna get some gloves on. Just do a quick visual inspection of the gloves. Make sure they are quality gloves. Perfect. Alright. Alright, so first I'm just going to take a couple of key vitals. I'm going to grab your blood pressure, your heart rate, and then I'm also going to take your temperature. I already grabbed your height and weight before coming here, right? Perfect. Okay, excellent. So we're going to start off with those few vitals, then we'll go into a little more detail, okay? Good, okay. So I am going to do blood pressure first. So what I'm going to ask you to do is if you can choose your left or your right arm, whichever you feel more comfortable with. I am going to apply the blood pressure cuff that had that Velcro cuff on your arm that applies some air to inflate it. It does have to go relatively high up to your arm, so if you can move your sleeve up about as high as you can make it, I can help as well. I would really appreciate it. It can be a little bit uncomfortable, so I do apologize for that in advance. Do you want to do left or right? Okay. Alright, go ahead and roll that sleeve up. Grab my stethoscope so I can hear. Alright. Let me just loosen this a touch. Alright, and I'm just going to fasten this around your arm, okay? And like I said, it can be a little bit uncomfortable. Alright, and I'm going to inflate that just a hair, okay? While we are doing this, what I'm going to have you do for me, I just need you to make sure you keep your legs uncrossed and then your feet flat on the floor or as close as you can. You can rest your feet on that step that's right there, kind of like a footrest. Alright, this is going to start to get a little bit tighter. I'm going to have you hold still for me. Okay. And I'm going to do the last couple pumps, and this is where it gets really tight. Alright, just keep those legs uncrossed for me. Just remember to continue breathing. Just going to check your blood pressure. Perfect. Thank you so much for that. We're just going to let that air out. Perfect. I'm just going to slide that off your arm. Such a good job. Yeah, no major concerns from me with your blood pressure, but your doctor will be able to give you more information, okay? Alright, So next I'm going to just check your heart and your breathing with my stethoscope again. You are good to unroll the sleeve. Thank you so much. So what I'm going to do next is to listen to your heart a little bit. I'm going to listen to it from the front as well as the back. I just want to confirm I am okay touching those areas. Perfect, thank you for that consent. So what I am going to do is to place this stethoscope onto those areas, again on your chest and your upper back. I will let you know when I'm also going to be listening to your lungs. During that time, I will instruct you to take specific timed breaths, okay? But we're going to start with the heart first. So if, again, you can stay as calm for me as possible, just sit back, relax, and don't forget to breathe, okay? Alright, so I am going to start off with your chest. So I am going to reach into your shirt so this can make contact with your skin, okay? Alright, so I'm just going to reach under your shirt. Okay, and I'm just gonna have you stay quiet for a moment. Again, don't forget to breathe. Okay, perfect. I'm gonna reach into the other side. Again, don't forget to breathe. Alrighty. Felt okay. Alright. I'm going to reach into the back now, okay? I'm just gonna reach around you. And again, this is under your shirt, against your skin. Alright, and the other side next. Again, into your shirt and against your skin. Perfect. Okay, so now I just want to listen to you breathing, okay? So I'm going to again reach this into your shirt. I'm going to focus more so on the middle portions of your chest, okay? Yeah, so I'm gonna reach into your shirt again. Alright, I want you to take a couple of deep breaths for me. Ready? In. Hold it and out. Good. Alright, other side. I'm gonna reach into your shirt and breathe in. And out. Perfect, perfect. Alright, good. Okay. Now I want you to do just standard breathing in through your nose and out through your mouth. I'm going to use this on your back now, under your shirt, against your skin. Of course. Alright, so in your shirt and just 2 regular breaths, okay? So good, okay. Now the other side and your shirt. And just regular breaths in through your nose and out through your mouth. Okay. Perfect. Thank you for that so much. Yeah, you did a really, really good job. Alright, so next I'm going to take your temperature, okay? Yes, this is freshly sanitized. Alright, so I am just gonna have you kind of lift your tongue up a little bit. This is going to go under your tongue. Yeah. Alright, so I'm gonna just. Alright. Let me just check. nose, not too far. Alright, so just hold still for me. I'm just going to rotate this a little in each nostril. Okay, and good. Perfect, okay. Excellent, alright. We will be able to get that sent out for testing. Alright, so next I'm going to do an inspection of your mouth and throat. I will use a tongue depressor, okay? Yes. Before I do that, I am just going to put this paper covering on your upper chest, okay? Okay. Alright, just hold still for me. Okay, perfect. some more information with you, okay?